and good afternoon, and welcome to the Your Health Reporter Ask Dr. MJ radio broadcast. We are here live in the studios, and we are here to answer your healthcare questions. We got our special guest in the house, Dr. Geoffrey Brown. GB is in the house. Atlanta Best D.D.S. He's in the house, and he's going to answer your dental questions as well. So you know how we do it here. We're going to take off the music. This is the People Show, and our opportunity to ask questions is what makes this program unique. See if I can move the camera over a little bit, Jeff. Okay, very good. All right, you good? All right, so now we're going to do our roll call. Holly, thank you so much. Let's see who we have here. It's not coming up yet. So there you go. Miss Audrey Ngalu from Slidell, Louisiana, right outside of New Orleans. Thank you so much for joining us this evening on our YouTube channel. Thank you, Audrey. Okay. Tricia Reese from Austell, Georgia. Hi, you're a local. Thank you so much. You're close to the office, and I hope you are a regular patient. If not, come on in. Linda Bloomer from Birmingham, Alabama. She's in the house as well. Very good. Okay, Rhonda Holiness Young from Tyler, Texas. Okay, we are north, south, east, and west now. We got west. Who's from California? Who's calling in from St. Louis? St. Louis, Lynn F. Hi from St. Louis. Midwest is being well represented here. So we're glad to have you here as well. All right, Glenda Everett. Glenda, thank you so much for joining us. We appreciate you as well. Thank you so much for being here. And for everyone who is here participating in the program tonight. Alicia Banks, hi from Cali. Now you're talking at West Coast. And we know you're 3 hours ahead of us. So thank you. Sean Big Time Green from Monroe, Louisiana, my first and most effective male follower. Thank you, Sean. We appreciate you being here as well. Cynthia Bird from Charlotte, North Carolina. Who you see, Dr. Brown?
Queen City.
All right. Queen City, Charlotte. Okay.
Big O.
Otis Washington from Ohio, OHIO. Otis is in the house. Glad to have you here also on our YouTube channel. Donna Hawkins, good evening from Facebook. Donna, thank you for tuning in. Okay, and I know that we have a birthday girl out there. I'm surprised she didn't load up yet. But I want to celebrate the birthday for one of our favorite longtime followers and a patient, Miss Makiba Boland. She is 21 plus, sexy as heck today, and we're so glad that she's here. Angela Wright, good evening from Columbia, South Carolina. Okay.
That ain't the low country.
That's not the low country. Very good. Okay, so we are here live in the studios, and we're going to talk to you about, we're going to continue what we spoke about earlier this morning on the Ricky Smiley Morning Show. And that was, again,
Geechees in low country.
Geechees in low country. Okay.
From Charleston.
From Charleston. Okay, very good.
He writes every minute.
He writes. So our special guest in the house this evening, Dr. Geoffrey with a G, G-O-F-F Brown. He goes by Dr. G Brown, Atlanta's best D.D.S, and he's here to answer your dental questions. Dr. Brown is a native of California, but he's been here in Atlanta for how long?
I'm not going to say, but it's in the 80s.
But in the 80s. Okay, now he came in the 80s. He did his dental school training at Meharry Medical College. And so we have been friends for quite a long time, and he is responsible for Dr. Collier's $1 Million Smile. So we appreciate that, and he can provide those same services to you.
You got a what?
A gaprectomy.
A gaprectomy.
We got a gaprectomy.
I got a patent that name.
He got a patent that name. So he took care of my Michael Strahan type gap. And now we have, as you can see, it wasn't that big, but it was big enough. And so we have that now. But we're going to talk about dental health questions. And I'll just get right to it, Dr. Brown. So let's start off with basic things. People come into the physician's office for an annual comprehensive physical examination. That's recommended at least once a year. And then I see my patients every 6 months for a routine follow-up. Now, what is the schedule for dental? What are you recommending right now?
Well, let me just say, it took me, I'm a little late in LA getting here. LA stands for Lithonia area, which is about 16 miles east of downtown Atlanta. And we're about, 12 miles west of downtown Atlanta.
Absolutely.
And the traffic here is terrible. But anyway, we see a lot of Medicare patients. And so we see people with missing dentition and fractured teeth and whatnot. So we do a comprehensive exam. And then we're trying to find out what the root problem is. And then once we get there, if something needs to come out, it'll come out. But we're really trying to get their gum situation healthy. We're trying to get the gum and bone situation healthy. So once we get that to a certain status, then it may be a recall from 4 to 6 months. And but once we get you stabilized, then that's what we do, 4 to 6 months.
Okay, so Dr. Brown, at what age should parents start bringing their children to the dentist?
Well, that varies. I used to see a lot of kids. I worked for Fulton County Health Department. I worked for DeKalb County Health Department. And in my practice, I saw a lot of kids. I see all adults now. But kids can come in as young as 2 years old or even earlier to a pediatric dentist. And so they may come in at year and a half, 2 years, but you're not going to get a whole lot of cooperation because of the immaturity of the child. But that's for them to decide.
Okay, so basically, once they have teeth, they're eligible for routine dental care.
Yes.
Okay, so they have teeth, they come in for routine dental care, and then let's say they are now out of elementary school, they're adolescents now. When should they really start spending quality time with the dentist?
At least every 6 months.
Okay, at what age?
Oh, starting from 3 on up.
From 3 on up. So
yes.
Okay, so age 3 on up. When and the permanent teeth come in at what age?
About 5 or 6 years old. It depends. And girls mature a lot faster than boys.
Oh, well, that's in every aspect.
Yeah, so, well,
that's in every aspect. So that's good.
So
good. Okay, so let's this morning on my Wellness Wednesday segment on Ricky Smiley Morning Show, we talked about Colorectal Cancer Awareness Month. That's March, and this is the last opportunity to talk about it. So we're going to do that right now. So March is designated as Colon Cancer Awareness Month, a time to raise awareness about the importance of screening and prevention of colon cancer. Colon cancer is the easiest to diagnose, but it is the least diagnosed. It is the easiest to treat cancer, but it is the number 3 cancer in men and women. Number 1 being lung cancer in men and women, regardless of whether you have a history of smoking. Number 2 being breast in women. Number 3 being prostate, number 2 being prostate in men. And number 3, colorectal cancer in both sexes. Now, but it is the number 1 cause of cancer death.
Don't y'all love how he knows all these statistics on the top of his head? He ain't reading off nothing right here. Ain't no book, no piece of paper, nothing. He knows it.
There you go. That's what we do. We are well versed in those types of topics. So starting at that, it used to be at age 50 that you got your screen for your colon cancer, called a colonoscopy. That has been lowered to age 45, mostly because the incidence of colon cancer has been increasing in the last decade. We are eating more processed foods that makes us more susceptible to colon cancer and a few other things right there. So we are having a pandemic right now of colon cancer. The incidence is going up. We are expected to diagnose at least 150,000 cases this year, of which over 30,000 will die from the diagnosis of colon cancer because of the late stages of that. So we're going to see screening opportunities. Now, you go to your primary care doctor, your internist, or your family physician, and for your annual physical examination, it should always come up as a topic. But no matter what opportunity you have for interacting with the doctor, if you have a sore throat, if you have an earache, if you're age 45 and above, you need to ask about colorectal cancer screening. The gold standard being the colonoscopy, but a viable option if you are not at high risk, being the packages like the Cologuard.
And can I
Absolutely.
add, one of our colleagues, one of our frat brothers is going through treatment for this exact illness, colorectal cancer. And so it's not anything to play around. It could happen to anybody, any of us.
And it does. Time. We just had a very prominent member of the Atlanta Medical Association pass away from colon cancer. When it was diagnosed, it was stage 4. And that is the biggest problem. We wait until we have symptoms, and then we deny the symptoms for a while or try to speak them away. I had spicy food yesterday, or I had something that changed my bowel status. I've been dehydrated, etc. And then by the time we finally get screened, it is too late. But if you do an early screening and early diagnosis, there's a 95% success rate. If you get late stage, it's less than 20% 5-year survival rate. So that's where we are with that. So if you have an opportunity, the gold standard, once again, if you have a first degree relative, that is, and people say, what is a first degree relative? That is a parent, a grandparent, or a child. So your parents, your parents' parents, or one of your children. Oftentimes we don't think about things going up. You get a young child being diagnosed with the disease state, and then you as a parent are at high risk as well. So if you have a high risk, or if you're having symptoms at any age, then you should get and ask for a colon cancer screening test, because the The incidence is going up, but more importantly, the age group is going down. So we're seeing it in younger and younger people. So it's something we definitely have to be aware of. And the ease and of a test like the Cologuard, where you basically it's ordered, the box comes to your home, you collect a specimen, you send it back by UPS or FedEx or some or U.S. Postal Service, and you get the results back in 7 to 14 days. The results are highly accurate. It's got an efficacy of over 90%. And so if you test positive for that, then you will have a diagnostic colonoscopy as a part of the follow-up. So colon cancer screenings, you get yours colon cancer awareness month, March. And so be aware that this disease disproportionately affects African American people, people of color. We have the highest incidence other than Native Alaskans. How about that? One thing, Native Alaskans are number one at colon cancer. I think it may be because they're eating all that blubber. I don't know. But we are, you know, in the continental United States, African Americans, we're number one in incidence, and we also have the highest death rates because of late diagnoses and problems with follow-up once we are diagnosed. So you have to understand how important it is to have a good working relationship with your primary care provider, so that you can discuss these things. And when he asks you to do something, I tell people, if you do half the things I ask you to do, you'll live a long, healthy life. If you do everything I ask you to do, you will be an amazingly healthy person. So there we are with that. So colon cancer. Now, let's get to your questions. This is the People Show, and you know how it works. You ask your questions, and Dr. Brown and I are here. There you go. Good evening, Dr. Brown, fellow California here from Miss McKee. Happy birthday, Miss Boland. Thank you so much. I thought that you might not have signed in. We wish you a happy birthday, but we're wishing it to you again. We want everybody to celebrate. 21 and super sexy. There you go. Okay. Next question. Okay. Read that, Jeff. I'm searching for a new dentist in my area, and I don't have specific recommendations. What are the things to look at or ask for to know to choose the right dentist? That's a great question.
Really, it's word of mouth, because I don't know what state you're in or where you are, but I've been in private practice for a long time, and in the last 10 years, I've worked for a couple of chain dentistry offices. And then I see people every week that bring me a treatment plan from another dental organization. And I'm not saying any names, but they're usually 40 to 60% higher than my treatment plan, because I've always lived by take care of what's there, do what's right, and the money will come. I'm serious. A lot of these people, not people, but organizations are motivated by money. They want to see what you're going to do every day. And if you don't make that mark, then they're going to let you go.
So it's a business. We're talking about not a privilege of providing quality healthcare. It's a business. How much can you churn?
Right.
So exactly. We want to make sure nobody should pick their healthcare provider out of the yellow pages or off the internet or whatever. It should be word of mouth, people that can tell you the quality of their service, the type of personality. And if you have an opportunity to meet your healthcare provider, that's one of the things we do at our community health fairs. You can literally come out and do an interview. Basically, you can meet your doctors, your cardiologist, your podiatrist, your dentist, and see if that's the person that you want to be your provider.
And then be aware of somebody once you get in. Oh, this is free. All this free stuff, or it's $50 or something like, or you don't have to worry about a copay. Well, they're gonna get you on the back end. I guarantee they're gonna get you on the back end, and they're gonna sell you. They're going to get you in a room, and they're going to sell you treatment that is really not necessary,
but very expensive.
So I would get a second opinion before you sign on and use your care credit or whatever else you have to finance your treatment. So I would always get a second opinion.
Okay, great question, Monica. We appreciate that. You. Next question. Okay, this Burks. Vanessa from Katy, Texas. I had a lipo-A test done that read 150. Is this something I should do as far as a lifestyle change? Thank you. Lipo-A is a breakdown of the bad cholesterol. The bad cholesterol is the low-density lipoprotein. That is the one that makes you have a heart attack or a stroke. The lipo-A or lipo-Lil-A is a subvariant of that is highly atherogenic, meaning it clogs your vessels up. your arteries in your heart, and it makes you have a heart attack or a stroke. So yes, that is an elevated level, and you can do something with a lifestyle change. Of course, I would add supplements like omega-3 fish oil. That is very good for lowering the bad cholesterol, increasing the good cholesterol, and lowering the total cholesterol. So you want to lower your total, increase your HDL, the high density lipoprotein, and lower the LDL, the low density lipoprotein. And then, of course, Dr. Collier's recommendation is always decrease the amount of fatty fried foods that you're ingesting.
How about bread?
I'm not a proponent of to take bread out your diets. You know, people like, I stop praying bread. And all the carbs, those are carbs. And carbs are not bad for you, are not necessarily converted to fat. So people say, oh, you don't want bread. You know, stop eating bread. And I stop. Any diet that totally alleviates one class of food is something you probably are not going to stick to. But it's very important you take supplements like omega-3 fish oil that can help that. But your basic guideline is this. Instead of trying to check a menu out, if it swims, you can eat it. If it flies, you can eat it. And your preferred method of food preparation is baked or broiled, not fried. So that way, you're eating healthy all the time. You don't have to worry about specific meals. Again,
stay away from Popeyes.
So actually, you know, fried chicken on occasion. But if you have a choice of going to Popeyes or going to your local grocery store where they have an entire broiled chicken for like $6 that will feed your whole family, and they have them flavored now. You can get lemon pepper, you can get barbecue, you can get all that stuff. And it's a very healthy preparation methodology. So you can go there and then go to the deli and get your 2 sides and feed your family for $10 or $12 versus $10 a person at a fast food restaurant. So great question, Vanessa. We appreciate that. Marcus Johnson.
Generally, bleeding gums is a sign of gum disease. You would need a full set of X-rays, an examination, and a diagnosis. And but okay, I tell patients all the time, what if your fingernails started bleeding? Would you think something wrong? I think you would. So it's not natural. So yes, if you have bleeding gums, I would just definitely talk to somebody and have an appointment to get your X-rays and examination.
Absolutely. And so Marcus's question was, my gums bleed when I brush. Does that mean I have gum disease or is it something else? Yes, gum disease is on the differential diagnosis. It could mean something else, but whatever it means, it's a pathological condition. Dr. Brown has so eloquently stated. It means something is wrong and we don't know it. Bleeding is always a sign of a disease state.
Right. And treatment could be as easy as scaling and root planing, which is, I do it on 80% of the people that come in the office, they haven't seen a dentist within 5 years. And especially some people, I see people all the time say, I ain't been in since COVID. Well, that's 6 years ago. Okay. So 5-6 years ago. So yes, you need to follow up. And once a deep cleaning has been done, that doesn't necessarily mean that you need surgery, but it's a non-surgical procedure. We do on about 80% of the new patients we see.
Okay, and that is curative. And so to save your teeth are actually made to last you a lifetime. And so oftentimes, particularly in the African-American community, we look forward to we get any dental disease or toothache, we want that tooth pulled. And so we end up with gaps in our smile and problems later when teeth start to shift. But if you have an opportunity to save any tooth, you need to do whatever it is that you can do to take away the pull the tooth option. All right, great question, Marcus. Sheila Alexander from North Carolina. What is amyloidosis? Amyloidosis is a disease state. It is thought to be an autoimmune disease. We're not quite sure what, where a substance called amyloid is deposited in your skin, in your connective tissue, and in your lungs in particular. So you can get amyloidosis that decreases the effectiveness of your lungs because it increases when oxygen is exchanged on a cellular level, the lungs have to be 1 cell layer thick. Amyloidosis creates a barrier that's more than 1 cell level thick, so oxygen cannot be effectively transported in the lungs. In other tissues, it just disrupts. 2 things cannot occupy the same space at the same time. So if you have amyloid plaquing or replacing connective tissue or inside your skin or muscles, then this can be a big problem.
Associated with smoking?
No, not associated with smoking. Again, it's thought to be an autoimmune disease process, but something that people can inherit and have a propensity for. It runs in families.
What's
So
autoimmune?
What's
Autoimmune.
autoimmune? Meaning that your body is kind of attacking itself, like a lupus.
Right.
Lupus is a disease state that's autoimmune. So great question. All right, thank you, Sheila. Tasha Williams, do I really need to floss every day? I brush twice daily. So isn't that enough, Dr. Brown?
You're doing better than most people. Really, because I get people to say, well, I try to floss, but it just ain't going in between the teeth right there. I get caught up. So yes, okay. When you floss, go up and down like I can't say that on this.
Well, you don't saw back and forth with the floss. You go up and down
like old folks. So anyway, yes, go up and down, and you're brushing. Yes, that can be enough, but it depends on how much plaque and calculus you may have on your teeth. But if it sounds like if you're diligent about this, then you're in good shape. So yes, that's a great pattern that you're following.
Okay, I got one question about flossing, Dr. Brown, because you have the long strings of floss that you pull out and tie around your fingers. You got floss apparatus that look like a U that holds the floss in between, and then you got the floss that looks like a toothpick that goes between your teeth. Any recommendation on either?
Well, manually, you'll get the better dexterity of feel. The little green ones with little hook on and the floss coming across, those are great. And they just go up and down, but don't saw back and forth because you'll destroy the connection between the tooth and the gum. Okay, so just go up and down. All right, between up and down that tooth, up and down that tooth, and you'll be in good shape.
Excellent. So Dr. Collier highly recommends that you go to the store where everything's $1 now, $1.25, and purchase your floss because they have a variety of different ones. I personally like the one that's got 2 strings instead of 1 because they're 2 thin strings and they're easy to go in and out between your teeth versus the 1 thick one, which I have difficulty getting caught up. I have on occasion had to take scissors and cut the end off the floss because it was just, I couldn't get it out of my tooth and I didn't want to pull my teeth out.
So sometimes some people have real tight contacts, and you have to use waxed dental floss. That's only because your teeth are really, really tight together. And in those cases, then you need wax floss, but otherwise just regular floss.
Okay, that is a point. I never knew why that some floss was marketed and promoted as wax.
Yes.
So very good. So now I see wax, I see peppermint, I see charcoal, I see all those different things. But the main thing is the actual act of flossing because food gets caught between your teeth, and I don't know why that happens as we age.
We're talking about that trying different things.
Yes,
I tried the charcoal toothpaste.
Yes,
I couldn't find anything different, and then when I read up on it, it's a little bit more abrasive than regular toothpaste.
Okay, and you don't want abrasive?
No.
Do you?
No,
okay,
no,
all right,
no,
very
no,
good.
Because then you start wearing away your enamel a little bit at a time. You say, well, what's a millimeter? A millimeter is a lot. What's a tenth of a millimeter? That's a lot if you're using it every day.
Yeah, so, because over time that will come back to haunt you.
Yes.
Okay, great question.
Thank you.
Okay, Shy Wilson. Hello, Dr. Kai. I want to ask you, to get rid of the muffin top, I've tried the capsule with lipo drops. Would you suggest the liquid drops? And my A1C type 2 diabetic was 6.8. Okay, 6.8 is very well controlled diabetes. Anything under 7 is considered extra control. Ideally, particularly if you want a GLP-1 like Ozempic or Mounjaro, you can get that under 6.5. But 6.8 is good control. No ifs, ands, or buts about that. We have a new product called lipoglucose. Lipoglucose, and that's it right here. I'm gonna see if I can get it in the frame right there. Can I get it? I think there you go. Lipoglucose. Now, this product is made to help your metabolism when you're diabetic, but more importantly, particularly if you're trying to lose weight, this product is 2 capsules a day, and it gives you some support, regardless of what your methodology is for weight loss, because when you lose weight, you're going to lose a percentage of muscle and fat, and our objective with products like the lipo drops is to make your your weight loss 90+% fat only. And so if you, for whatever reason, if you gain weight back, you're not going to change your somatotite. And that's what we want to do with that. So lipoglucose is a new product that's available on the website. Go to lipodrops.com, look up the lipoglycose, and see if that's a product that may work for you. Okay, next question. Darnell Robinson, I love sweet tea. Oh my God. I heard it can stain teeth. What is the best way to prevent stains?
It's hard. It's hard to say that because Coca-Cola, any colas, anything dark, teas, coffee, they stain teeth. They just stain
Red
teeth.
wine.
Red wine, yes.
Brown liquor.
Crown Royal. So, give myself. So, but anything dark is going to stain red or dark liquid or food. It's going to stain your teeth over time. So there's really nothing you do to prevent that. There are different so-called whitening toothpaste, and I can't recommend one over the other. And then even if you go get your teeth whitened, it's going to be a few months. They can go back to the shade they were before, okay? Because whitening is not permanent. Whitening is something that where you take a hydroxyapatite and you take out hydroxy peroxide. You're really etching the teeth in a way, the enamel, to get out the stains that are present right then. And so you're like, oh, that looks great, but it's not permanent. So yes, if you drink tea, coffee, colas, red wine, that's going to stain your teeth.
There are some disease states as well that can cause darkening of the teeth, so we need to be aware of that. And so you partner with your dentist and your medical provider to make sure that that's not the cause of problems with like your bilirubin metabolism or problems with acid reflux, which also is not only darkens the teeth but also eats away at them. That acid is horrible. But guess what?
On the lingual, on the inside,
the darkening of the teeth is the least thing you should be worried about with sweet tea. We need to be worried about the calories in sweet tea.
Try unsweet tea with a little. I mix mine about 80% unsweet and 20% sweet, and try that out. See, it's an acquired taste.
Yeah, but it still tastes just as good. Oftentimes, we make our tea taste like syrup, and so that is a big problem. But understand this: your body does not recognize liquid calories. So if you're drinking something like sweet tea, which is nothing but liquid calories, you're going to gain weight or find it difficult to lose weight. I have a lot of patients who are in the weight loss program. They are eating perfectly. They have the perfect diet, but they drink their calories not knowing that you don't get a sense of satiety, which means you don't feel full when you drink your calories, and you'll just keep drinking because you feeling thirsty versus actually wanting that. So, and something about a sugary drink, it goes to your brain, it makes you crave it. Your brain considers this as a positive sensation. It gives you a serotonin effect. So it makes you feel good and it tastes good and you want more of it. So you need to avoid those sorts of things to optimize your weight loss journey or to maintain a good weight. So a tea that is sweetened with an artificial sweetener, and I highly recommend either the yellow packages or the blue packages as equal.
What about the pink?
Well, the pink has some problems. So I don't, and plus, in my opinion, it doesn't taste that good. But the pink, the green, the blue, the green, or the yellow are great artificial sweeteners, and to see what you think about those. And then also immediately rinse your mouth out with nothing but water, just to remove, don't let it sit on your teeth and stain. Once you finish drinking that, drink water and rinse your mouth out almost immediately. I will always go to the restroom after I eat a meal. And if I can't brush my teeth, I definitely just rinse my mouth out to remove that.
Especially if you had a Chinese restaurant and a Chinese buffet, because you're going to be there for an hour, 45 minutes to an hour.
Long time.
Back to get a refill, right? And they said, you want more? You want tea?
You want
they
more
always
tea?
ask me, so, oh, you're very thirsty. I had three cups, but I always get unsweet tea and they get a little sweetener to go along with that.
All right. Very good. Next question. Okay. Eureka Thomas from Macon, Georgia. Okay, about the lipoglucose, the direction says to take 1 or 2 capsules daily, but the website says 2 to 3 capsules before your meal. Which direction is correct? You could take up to 3 of them, but 1 or 2 per day is good enough. It depends on your glucose status. So the lipoglucose, just as a supplement to a weight loss program, 1 to 2 will be fine. If you actively are a diabetic and you're trying to control your blood sugar, then 2 or 3 would be good as well. It has nothing to do with your weight. It's more related to your glucose status. So we want to make sure that conflict is straightened out as well. Thank you for bringing it to my attention. But again, I'll say from 1 to 3 capsules, depending upon how you take them, because you can take 1 or 2 at one time, or what I recommend is taking 1 with either your breakfast or your lunch and 1 with dinner. that kind of help optimize and balance your metabolism versus taking two together at one time and making things go down, because your body rebounds and comes back up, and we don't want to have that effect. We want to try to have smooth sailing, staying right there. There's an amount of fluctuations, but we don't want the big ascensions and the big descensions. All right, great question, Erica. Thank you. Eureka, the J&A family. All right, I've been taking the products for lipo drops. I lost quite a bit of weight, but now I'm at a standstill. Any suggestions? If I hope you're doing as part of your lipo drops weight loss journey, intermittent fasting. That is what I'm recommending. There's also a weight loss program that we have where you eat literally 5 times per day. So you could be somewhere in that spectrum. The biggest problem that oftentimes we have now, we start to lose weight, we're eating less, and we're not eating enough to maintain a good metabolism. When your metabolism is not steady, five times. That's breakfast, lunch, and dinner, a snack in between breakfast and lunch, a snack in between lunch and dinner. The purpose of that is your body then realizes that you are not hungry, and you don't ever experience hunger. You just maintain a good fuel level. When your body realizes that it's not hungry, it stops storing food as fuel, that fuel being fat. And so at first it says, well, Dr. Brown, you just playing. You're not really serious about this. So we'll just stop storing fat, but we're not going to do anything differently. But then after a few weeks, your body says, hey, not only do I not need to store food as fat, I can let go of some of the fat that I've already stored because I don't need it, because I have new fuel coming in every 3 to 4 hours. And your body much prefers fresh fuel than converting fat to fuel, which is a process that creates a catabolic circumstance in your body. And it creates some other problems that are not good, but your body will do it. And so the extremes, people that only eat once a day, and then they don't understand why they're not losing weight. And that's why, because the body interprets that as starvation and says, well, I don't know the next time I'm going to eat. So every time I do eat, I'm going to store this food as fuel or fat. And then people that are eating out, most people do not eat like they do on my 600-pound life. That is an exception. Most people, particularly though, as we age, you're eating the same amounts of food, but your metabolism is going down. So you don't need as much to maintain weight. So you start to put on weight, and it's slow, 3 pounds, 5 pounds a year. That's nothing. Except after 5 years, it's 25 pounds. And after 10 years, it's 50 pounds. And so that slow creeping weight gain is what gets you. And you say, but I'm not eating any more than I always have, Dr. Collier, I promise you.
So
and that's why. Well, walking helps, but you don't lose weight by exercising. You get fit by exercising. And this is why the formula, the mathematics don't work out. To lose 1 pound, you have to burn 3,500 calories. Okay? The average vigorous workout, if you join LA Fitness or My Spa or wherever you go, and you work out vigorously for a whole hour, you're only going to burn 800 calories. Most people don't work out vigorous for an hour. They socialize for 40 minutes and they work out maybe for 20. But let's say you do the perfect workout. You work out perfectly for 1 hour, you burn 800 calories. You know what the most common behavior is after going to work out?
Drinking.
Going to eat.
Oh,
no. And the average caloric intake after a workout is 1,250 calories. So 1,250 calories that you eat, you only burn 800 with the perfect workout. So you're now working out 3 or 4 days a week, and you're not only not losing weight, you're probably gaining weight because the numbers just don't add up, which is why Dr. Collier says you lose weight in the kitchen, not in the gym. You get fit in the gym. Now, there's a caveat to that. If you don't work, don't have a family, don't have nothing else to do, and you're in the gym 4 or 5 hours every day, you will lose weight doing that.
Yeah.
But regular people can't do that. Even people start off with a lot of enthusiasm. In January, everybody signs up for the deals at the gym. And then by March, they're asking me to write a letter saying they can't exercise so they can get out of those contracts that they've signed. Dr. Collier doesn't do that. They say, why won't you do it? I say, because you need to go. But understand that you're not going to the gym to lose weight. You're going to the gym to establish a high level of cardiovascular fitness. That's what you do. Okay, great question, Jake. Well, year round. But in January is when the highest number of people sign up.
I didn't drink.
Oh, okay. What do they call that now when people don't drink in January? Sober. Angela, right? I chipped my tooth because I grind my teeth. My dentist recommended a crown for the chipped tooth, and that I get liners to help with the grinding, also to correct the spaces in my teeth. Does that sound about right?
Yes, it depends how much of the tooth is chipped. If it's a front tooth, one next to it. If it's well, I know most people don't know millimeters is measurements, but if it's 3 or 4 millimeters, you get a white filling. If it's more than that, then it may need a crown. But okay, so grinding is an interesting condition. We don't know what we do at night when we're asleep. A lot of people I see I just see people that have their back teeth are almost flat, and it's not from eating nuts and chewing on dates and stuff like a lot of people from across the water have you, or diets that would eat that. But you can't control what your muscles do at night. So when your teeth are grinding together and they wear down, I really recommend a night guard, whether it's hard or soft plastic, either one, because at night your teeth will try to lock in together. But if you have this night guard, it's smooth, and so they won't grind together. In other words, the bottom teeth will mesh against the top plastic appliance.
So slip and slides instead of grind. Now that's a medical condition called bruxism, right, where you have that and you grind your teeth together, and it literally will physically grind the teeth down and create problems over time because you're cracking them ultimately, yeah. And this can be a problem.
Okay, don't get your liner from Walmart or CVS or Walgreens, wherever you go. Go to a professional and get your night guard done.
Custom made.
Custom made, because yeah, they work for a little while, but they're gonna break up. But go to a dentist, please, and get your impressions done and get a night guard made.
So that sounds about right, Angela. Sounds like your dentist has made a viable treatment plan for you and that you're going to do well with that. I see that $1 million smile on your Facebook profile picture. We want to see if you still have that smile coming back. Hey. All right. Very good. Next question. Okay. Brianna White. My teeth are sensitive to cold. Could that mean I have cavities, or is it something else?
Well, depending on your age, it could be, if you're in your 40s, 50s or beyond, it could be gum recession. And so what gum recession happens over time, you could have a medium or hard toothbrush or just a soft toothbrush, but you could be aggressively brushing. And so if the gum recedes and it exposes the root structure, that's closer to the nerve. And so that's why your teeth are sensitive. Okay. Don't go to somebody and say, oh, we need to do root canals and we need to do all these crowns. Try Sensodyne try Sensodyne toothpaste for at least two or 3 months. If sometimes it can be 1 or 2 teeth specifically that need a composite filling, but other than that, I would address it with Sensodyne. Try that for out.
And you can buy it at the store where everything's $1. I just bought a tube, and it is very effective. Because I was having some sensitivity issues until Dr. Brown took care of my fractured tooth. He just looked at my mouth and said, your tooth is broken. And I was like, what? That's why it's bothered me. And now I've been not sensitive and pain-free subsequently. But I did use the Sensodyne with a great response, actually. I thought it works very well. And so I was happy to see that. And it only cost me $1.25 to try it. So that was good. As a matter of fact, the one that I bought came with a toothbrush with it. Now, so 3 questions. 1. Toothbrushes, soft, medium, or hard?
Always soft.
Always soft. Okay.
Always.
Then why do they make medium and hard toothpaste?
Because some people feel they're not getting the sensation by brushing with a soft toothbrush, so they would use medium and hard.
So a soft toothbrush. 2nd, brush technique. In my lifetime, I have seen it go a full circle. When I was coming along, I was taught up and down, up and down, up and down. Now I see people saying round and round and round. Which way do you recommend?
Round and round you go. So what you want to do is put the brush on the teeth and do a gentle circular motion, and that will get the bristles in between the teeth and then come up.
Okay, so circle around, circular motion.
And then up.
Okay.
But not definitely don't scrub back and forth. That's not going to do anything.
Lastly, okay. Yeah. Now, big question. Motorized toothbrushes, ultrasonic toothbrushes, toothbrush, the little one that's round and goes round and round, or the big ones that go like this, back and forth, back and forth. Recommendations.
They were good because some of those 20 to 40,000 impulses a minute, but you just can't be abusive when you can't just go back and forth. Just sit up there and still the same thing. Sit up there and go down. Sit up there on the bottom. Sit up there on the teeth. Let it go and then come up. Okay, but don't press too hard.
Okay, very good. And those are readily available now. Virtually most of the stores,
Mhm.
you can get a very nice one for $20-$30.
Right.
And so you can always get them on Amazon or someplace like that. But I have seen and I have appreciated one. Now, lastly, Geoffrey, the blue light that I see, antibacterial for your toothbrush, for your teeth. I see a thing that's like a mouth guard you're supposed to put in your mouth. Then I see blue light to store your toothbrush in because it kills the germs, or a ultraviolet light.
Ultraviolet light. That's good if you're in your bathroom, especially if you have a small bathroom. That it will help kill the bacteria that's in the toothbrush. Yes, that's good. My wife has one, and we had one, and
that means you don't use it. She claims it's bad. This is bad. Don't you use that? Okay, so we have that. So a good thing. And then lastly, and I said that 3 times already. How often should you replace your toothbrush?
Every 3 months.
Every 3 months now. Okay, very good. Every 3 months, a fresh toothbrush. Or if you have a respiratory tract infection, particularly cold, flu, bronchitis, strep throat, a bacterial infection like strep throat, you use that toothbrush, you throw it away, you use a different one while you're in the disease state, say taking your antibiotics for 10 days. Then you dispose of that one, because if you do not, you can reinfect yourself with a contaminated toothbrush if you have an infectious disease that is oral in nature. So you want a new toothbrush, and so just get several. Again, you can go to the store where everything's $1, get some nice
$1.25
soft toothbrushes,
soft.
2 in a pack. You get 2 of them, including with the tongue brush on the back of it. And so you always got a fresh one in place. So you have them now. Or you go to visit your dentist and tell them, I want some toothbrush samples before you walk out the door. They'll give you a nice little goodie bag.
But at the same time, if you're wondering about cavities, go see a dentist and get an exam.
Absolutely. You don't take the guesswork out of it, because
Right.
if most of the time when you think it's a cavity, it probably is. Okay, next question. Carla with AK, is an active sex life beneficial for diabetic men? Absolutely. Not only is it beneficial for diabetic men, it's beneficial for short men, tall men, dark men, skinny men, light men. It's beneficial for women. An active sex life is beneficial from this perspective, particularly if you're a diabetic man. One of the key signs, one of the reasons I diagnose diabetes is people will come to me asking for a prescription of Viagra. They'll say, Doc, I need some help down there. I tried this. I need some Viagra. And I say, well, let's evaluate what the problem is. The problem is not that you have erectile dysfunction. The problem is that you have diabetes, which destroys and inhibits the blood flow to the penis. The blood flow to the penis is the mechanism of erection. You get excited, a valve opens up that's like the Panama Canal. Blood rushes into the penis. The valve closes like the Panama Canal and holds that blood in there. You have sexual intercourse, you ejaculate, the valve opens and lets the blood out. It happens 100% of the time. So when men tell me, oh, I can go all night, Dr. Collier, no, you can't. You lose your erection after ejaculation. That is the normal process and procedure. But if you are an active sexual partner, you develop a level of sexual physical fitness. It's just like if you go out and run, if you exercise, if you go to the gym 4 times a week, you're going to be in better shape. So oftentimes men start to have some erectile dysfunction and they start backing away because they're concerned about failure.
Don't y'all love how he explains this scientifically?
They don't want to fail in front of their partner.
Get the right girlfriend.
That's an option too. So we call it the lap dance
single
test.
People. Not
there you go.
Not
So the point being, though, that you develop a level of sexual physical fitness. Sometimes you might need a little help. Products like Viagra, like Cialis, or there are others out there as well. But my Lipo T product is one that instead of taking intermittently when you feel like you need it, you take that every day so that you develop a level of sexual physical fitness and sexual health so that you're able to function whenever you want to versus whenever you need to.
So you stay away from the one at the convenience store?
Absolutely. No, don't buy any pharmaceutical products from the bulletproof gas station. Okay, so if you see a whole display of rhino pills and sexual enhancers and things, you can buy 2 pills at a time, don't buy that, please. Dr. Collier highly recommends that. Partner with your, don't be shy about having that discussion. If you have a provider that you can't have this kind of discussion with, you have the wrong provider, because you should be able to talk about anything and any topic. Maybe not the first time you see them, but after you get to know them, y'all should have developed that rapport. I tell my patients, I say, we're good friends by now. There's nothing you can't talk to me about. And if you feel comfortable with it as a provider, then the patient will feel comfortable. If the patient feels a little trepidation, and then you're mirroring that back to them, then it's going to be difficult to have that conversation about such a sensitive topic. But if you just say, hey, it happens, welcome to my world. That's my first. I say, welcome to my world. I take the Lipo T every day, and I'm glad that I do. And Mrs. Collier is glad that I do. So we are glad of that. Okay, next question, Carla. D'Amica Coleman. I've had 2 weight loss surgeries. I've gained back most of the weight. What do you recommend? I recommend one. If you've had 2 weight loss surgeries, a gastric bypass and or gastric sleeves, what used to happen was that if you had the surgery, most people would gain the weight back within 3 to 5 years. They lose 100 pounds. That was the standard. They gain the weight back in 3 to 5 years. When you have the surgery, at that time, when you're markedly overweight, your stomach is about the size of a 2-liter Coca-Cola bottle. Picture that, a 2-liter bottle. They take that in their surgery and they fold the stomach onto itself, or they cut it down so it's about the size of a banana. So the absorptive area, the area of the lining of the stomach that absorbs calories, has been minimized. So that's why you lose weight. You just cannot eat. The problem with that is the stomach is a living, breathing organ. So you go from being the size of a banana or having a diameter that big, and then you stretch it back out, and you eat more, you stretch it back out. And before you know it, you're right back to where you were. You've gained the weight back, and your stomach is back to the size of a 2-liter Coke bottle. Well, the doctors at that point used to say, you out of luck, no problem. I'm sorry that it failed you. You're a surgical failure. Then people started specializing in a subspecialty called revision of gastric bypass or gastric sleeve.
Stay out the Waffle House.
Stay out the Waffle House. And so you can keep your gallbladder too. But when you do that,
now I don't have a gallbladder, right?
And we know why.
And you said it was my Waffle House diet. And where did we go to eat after we play golf?
The Waffle House.
Thank you.
But you don't have a gallbladder now, so no problem.
No problem.
But when you do that now, it can be revised. But what you need to also do is embrace. That's why the most successful individuals for any weight loss program, there's a counseling component that is real, which means they teach you what to eat, how to approach food, so you're not having, the new term is food noise. Constantly, you get the urge. There's a hormone in your body called ghrelin. The gremlin. Ghrelin tells you to eat, and it gives you that drive that's stronger than your sex drive. So I tell my patients, you can't fight the gremlin, because the more weight you lose, the higher that level goes until you start eating and until you get back to whatever your preset weight was when you were overweight. So that's a great thing about these new products, the new injectables, the GLP-1s, that's the Mounjaro and the Ozempic. They block the development of the ghrelin. That's why people aren't hungry. That's why people don't gain the weight back. So you would be a perfect candidate, D'Amica, for a GLP-1 therapy, because it is as effective weight loss method as a gastric bypass or a gastric sleeve. So if you would lose 100 pounds with a gastric sleeve, you can lose 100 pounds with the GLP-1 injectables if you can tolerate them. And most people can. They are very safe, and most people can tolerate them. You start off at a very low dose, and you titrate up to the highest dose. The highest dose for, say, for instance, the Ozempic is 2 milligrams. The highest dose for the Mounjaro is 15 milligrams. They aren't equivalent, so you can't look at it from that perspective. 2 milligrams is going up in a systematic methodology instead of just going to the highest level immediately. You can't do that. And so some people they never have to reach the highest level. One, because it works for them at a lower dose, but two, they may have side effects at a higher dose. And so you have to work with your provider. That's why you don't buy these things on the internet, because it's a little more complicated than just going online and ordering it and getting it to your house. Then what? I have people that come in my office with little packages. I order this on the internet. How do I use it? I don't know. You got to go on the internet to find out.
Don't you hate Dr. Internet?
I hate Dr. Internet. But now that people can get medications and prescriptions on the internet, this is a big problem. So, D'Amica, look at that as a GLP-1. Talk to a specialist in weight loss. They are doctors that specialize in weight loss. I am one of them. So I'd be happy to see you. You come to see me. I have people that, if you're around the Atlanta area, I have people that fly in from wherever to come to see me, and we can get you on the program. But you can communicate with me directly, and we can see what best works for you to get you the best you that you can be. All right, D'Amica, great question. Tyrone Lewis. Oh my goodness. Are gold teeth bad for the gums in the long run? My uncle says they cause problems.
Okay.
Greatest question of all time. This might be the question of the day, Tyrone. Okay.
If you were, say, a teenager and wanted a gold tooth and front tooth with your the initial on it or what have you, or solid, whatever, a lot of practitioners would shave a little bit off the backside and the front side of the tooth to fit that gold crown on. And that is a terrible restoration. In practices I worked in for Dr. Reynolds and Dr. Moore, they call it Aphrodontics. And we would not do that because it's bad for your teeth. However, if you get a solid gold crown or inlay, then that is one of the best restorations you can have. Okay, so I'm not going back to the Egyptians, but because they would hammer out gold, and then it was like aluminum foil. They roll it up and then use it to fill teeth by a certain method. But gold has a very similar chemistry to natural teeth in expansion and contraction. That's why silver fillings fail over, and white fillings will fail over years too. But as far as gold teeth being bad for the gums, it depends on more or less not the gold, but it depends on your health of the gums itself. The gold is not going to make teeth go bad, the gums go bad. No, it's your hygiene.
So taking care of them. Now, let's talk about people go to the mall and they have a little kiosk in the center of the mall that sells gold covers, I guess, or inlays or whatever you call them.
I make nice crown for you. I cleaned it in Coca-Cola. Seriously, that happened over in the over there by the Camden Road.
Okay, all right.
The guy told me that. I said, well, how much are the gold crowns? I said, well, how do you clean it? Oh, we put them in Coca-Cola. Well, that's not sterilization. That's not even sanitization. But what I'm saying is, if you get them just slipped on, especially by somebody who's not a dentist, no, it's not good for you over the long run.
Is it good for you in the short run? Are those mall bought grills
not at all.
Even real gold?
They can be.
Oh, I know they can be, but
they could be gold alloy.
They can be gold alloy, okay, which is a safe product to put in your mouth. I'm asking.
Well, yeah.
Okay,
it's safe, but it's still not. If it's not placed by a professional, then you run the risk. Because I see a lot of people. I take they're 37, 38 years old and say, I had this on here since I was 18. And I take it off, and sometimes the tooth is healthy. A lot of times it's just rotted out, and we have to do a root canal and then put a normal crown, a porcelain crown on.
Okay, all right. So that's good information right
Thank
there.
You, Tyrone.
So I saw that recently in Atlanta, somebody announced the opening of a dental facility. I won't even want to say clinic that specializes in these decorative tooth inlays, grills, and whatever. They go into a high-end clientele because I guess they were talking about diamonds and everything else. They said, you don't have to go to California to get your teeth done. Now we can do it right here in Atlanta. And so, when you see some of these artists, performers that have full, diamond grills, gold grills, whatever, what does that do to the teeth underneath?
Well, it depends who places. If a licensed dentist, places a crown, whether it's gold, porcelain, titanium,
amalgam, silver,
platinum, then if the dentist places it, then it's going to be acceptable within dental standards. However, if it's placed by somebody off the street, somebody said this is Larry, he's the man to get your hookup and get your grill done, then no, I wouldn't touch it. I wouldn't let anybody touch my mouth who didn't have a license in whatever state you're living in.
Okay, great point right there, and that's a definitive statement. You need to get your dentist and your dental grills and all of those decorative things from a licensed dental professional, a dentist who has experience in doing those things, not at the mall, not by your friend's friend who putting them in or whatever, because you're going to have some dental problems overall.
I see a lot of people who've had work done in the Caribbean or even South America, Colombia, that go for 2 days, and they come back and they'll have all these veneers and stuff done. Well, most of them, not all of them, most of them are done in composite, plastic filling. They absorb red wine, Coca-Cola, tea, all these things. So in less than 5 years, they're not going to be white. And so they come to me and say, well, now can you get me straight? And I said, yeah, well, it's going to be this. This is the way it should have been done in the first place.
Uh-huh.
And so I see a lot of people that have done I call it sidewalk dentistry, and then there are people that do it in their garage, in their basement, that will do composite fillings and whatnot, and then they come to me crying, "Oh, well, I thought this was going to last a long time. It lasted 8 months."
If that.
And so, so you really need to go to somebody like, would you go? Okay.
Next question, Hailey.
Would you go to somebody on the street and get your gallbladder removed? Would you go to somebody on the street and get your what happened?
Deborah Bell, are implants safe for diabetics? If we're talking about dental implants, most of the patients that I have that are diabetic, they have dental issues, end up getting dental implants because of that. But Dr. Brown,
if you are being treated and if your numbers are right, yes, implants are safe. I would really go to an oral surgeon rather than a general dentist for implants if you have diabetes. I work with a gentleman who I've never seen anybody place an implant so fast. He did an implant like I did a filling, but there was a patient there, and we tried to put a crown on his implant, but he didn't take his medicines correctly, and his numbers way off, and so his diabetes was uncontrolled. And so his implant did not work. It was loose. So the implant is based on the fact that you can put this titanium device in the gum, close it up, wait about 4 to 6 months, and some wait less than that, and then the bone will grow against the implant, and then implants done correctly, that's like rebar in concrete. I mean, they ain't gonna move. You can move an implant, but it ain't gonna shake.
Stronger than your regular teeth.
Yeah,
okay, so to answer the question is, Deborah Bell, if your diabetes is well controlled and you have a normalized hemoglobin A1C, meaning less than 7, and your diabetes is well controlled, you will have a better outcome and a better outlook than if your diabetes is questionable or if you're not taking good care of the blood sugar. So again, a partnership between you, your diabetes caretaker, your primary care doctor, your internist, your endocrinologist, and your dentist. Y'all should all be working together to optimize your health, one, to make you a better dental candidate for an implant, and then do the implant. So you just brought up a good point, Dr. Brown, because I've heard both ways. I've heard people get the root or the base of the implant placed, and then it has to set and bone has to grow in it for months. But then I see advertisement for 1-day dental implants. You come in, you get your MRI, you get implants, you get all that stuff in 1 day. How does that happen?
I don't know.
Not recommended.
They have good malpractice insurance.
Okay.
And I'll say this: anytime anybody gets an implant, you have to have a full blood workup. You have to. There's no variation from that. They take your blood pressure and say, "You're good to go. We're going to do the implant." No, you need a full workup because they have to check your general health. Because implants are nothing to joke about, because you're putting in an artificial, a man-made device. Into your bone, and you're looking for what we call osseointegration. In other words, the bone is going to grow against the tooth. Teeth are connected to bone by microscopic fibers called periodontal ligaments. I'm not trying to get you scientific, but anyway, you can shake every one of your teeth. You can shake it a little bit, maybe 0.5 millimeter or so. But an implant,
it's gonna
where it goes, you go. Okay,
right.
So that's the difference.
Okay, great question. This brings to a close. We're going to take Pamela's question. This will be our last question. I have a space between my side tooth due to not wearing a retainer after many years, and my teeth have shifted. Now that the tooth that my retainer fitted on is a crown, and my dentist is recommending crowns because the space is too large to bond. Any other options available? Seems like you discussed them all with your dentist. Go ahead.
If you can't go back to your orthodontist, I would see an orthodontist. I recommend an orthodontist. And depending how large the space is, if it's Michael Strahan, I mean, we used him to reference, that's pretty big space to close up. A lot of times you can use bonding to close, say, a 3 or 4 millimeter space. That's about 4 millimeters. But get a measurement, you'll see about 3 or 4 millimeters. But I would you have a couple of options. You could do either bonding, or you might need 2 crowns, and then you wouldn't have to worry about your retainer anymore.
So an orthodontist, or there such a thing as a subspecialist that specializes in smile restoration or whatever?
Not really.
Not
It's
really.
either
Just
general dentists or and a lot of general dentists do orthodontia.
Okay. All right. Okay, that was the final question. This brings to a close this episode of the Ask Dr. MJ Why Because Your Health is Important with our special guest, Dr. G. Brown, Atlanta's very best D.D.S, giving me that $1 million Hollywood smile. All right, we greatly appreciate that. And remember, go to the website, lipodrops.com, where you can find information and products to optimize your health, supplements that will boost your immune system, improve your sex life, Lipo T for the men, Lipo Hers for the ladies, our new products, Lipo Glucose. If you're in a weight loss program, particularly if you're using the GLP-1s, you want to make sure that you're losing fat only and minimize your muscle loss, because you will lose muscle if you don't do that. Okay, go to the website, lipodrops.com. And remember, these are the opinions of Dr. MJ Collier, not those of Dr. Geoffrey Brown, our DDS to the stars. But we'll see you next time.
Everybody is a star.
Everybody is a star.